Good evening, everyone. This is Superintendent Dr. Romulus Durant. I am the Superintendent of Toledo Public Schools, and joining me are my co-chairs. We have Mr. Tom Hosler, who is the Superintendent of Perrysburg. We have Ms. Lynn Casto, who is the Head of Schools of Maumee Valley. We appreciate each of them. We have worked together collectively to be able to provide a town hall meeting, to be able to have an important dialogue and conversation regarding the vaccination, which we all want to know more about. So with that said, we are both all part of the Project B project, which is part of the educational committee, which we had spent the last several weeks really designing and preparing kits to be able to provide information, whether it's social media, whether it's within the schools and within the community, to be able to educate in regards to the topics of the vaccination. And today is a town hall where we're bringing physicians here to have conversation and to be able to answer questions. One, not only questions that we're providing, but we're going to do this interactive. We're going to allow those on social media to be able to ask questions, which Ms. Casto at the end will begin to start sharing those questions, allowing our physician to be able to answer. Again, we have all been through some trying times since the month of March in regards to some of the challenges and the struggles, in regards to this battle with the pandemic, in regard to the coronavirus. And so many of us school leaders, whether it's board members, superintendents, educators, and union leaders, have all had to come together to really make some difficult decisions in regard to how we were coming back this fall in education. Some of us came back 5 days a week, some had came back hybrid, some had even went remote, which is a whole new challenge in regard to education. But I take my hats off to our educators because we have become one of some of the best, safest havens in regard for our kids to come to in regard to continuously wearing masks, continuing to hand sanitize. At the same time, social distancing ourselves within our buildings had really helped in regard to the spread within schools and into the community. Well, today we're going to really hit hard on the topic because the first step in getting back to normality is the ability to have a vaccination that allows us to be preventive as opposed to much more interventive. So with that said, we're going to continue to move on with the agenda. We have quite a bit for you in store today, but with that said, we're going to bring aboard our mayor, the mayor of the city of Toledo. Welcome to the stage and presentation on the platform is our own Mayor Wade Kapsakabic.
All right, thank you, Dr. Durant, and thank you all of you for being on this town hall this evening. I really just want to emphasize 2 points. One is it's going to piggyback a little bit on what Dr. Durant said. I just want to say on behalf of the citizens of Toledo, thank you to all of you educators, everyone who is in the field of education this past year, in one way or another, faced challenges that they could never have comprehended before. I mean, going from in-person instruction to remote instruction to hybrid, often within the same school building, within the same month. It was not uncommon in our community, and all of the many challenges of trying to, educate children who are on different sides of the digital divide. I mean, it's just extraordinary. And, I come from a family of educators. My mom was a teacher, and while my dad was a police officer, he has 3 sisters. They're all teachers. I've tried to do some things pushing education issues as mayor. So the first thing I just want to make real clear is we are so thankful for everything that you've done on behalf of kids this last year, because you care about kids, but you got to care about yourself too and your own health. So it's been a tremendous challenge. And one takeaway that I want to make sure you understand is we're just indebted to all of you. But the second thing I want to say, and this transitions to our next speaker, is what an important moment we are at right now as we attack this pandemic. I don't know about you, but I'm about fed up with the social distancing and the masks and the restrictions. I mean, I get it. I know why we have to do it, but I'd like to go to a Mud Hens game this summer and go see the walleye and, go to the Solheim Cup and go to a concert downtown. And I can't tell you how bad I want to do that. And I know you do too, to say nothing of getting in the class with your kids. To do that, we are going to have to get ourselves vaccinated in a way that challenges some of the percentages we're hearing. We all see the statistics nationwide. It's kind of a 50-50 split between those who are excited about getting vaccinated and those who need some persuading. There's a lot of folks who have doubts, and I get it. There are many communities, especially communities of color, who have some understandable concerns and memories of, whether it's the Tuskegee experiments or whatever the case may have been. We have a hurdle that we have to overcome with many people in our community if we're going to get to that 70% level that we need to get to in order to go back to normal. The person I'm about to hand it over to, Sean Savage, is a gentleman who began a project about 6 weeks ago called the VProject. And you'll hear from him directly, but essentially it is a community-based grassroots effort to promote vaccination, to do it frankly, peer to peer, friend to friend. I get that sometimes folks aren't convinced when some schmuck politician like me says, you ought to do this, it's good for you. But it might work better if your coworker encourages you to do it, or the teacher in the next homeroom says you ought to do it, or your pastor, or your daughter's volleyball coach, or whomever it is. And so the VProject is a coalition of hundreds of community partners, including our friends in education, to do our part to spread the word about how effective this vaccine is and about the good things that will happen to our community if we can get those shots in our arms. So thank you again. And now I'm going to turn it over to Sean Savage to talk more about the VProject.
Thank you, Mayor. I appreciate it. Thank you to Lynn, Casto, and Romulus, Durant, and Tom Hosler for your leadership in developing this K-12 virtual town hall. Dr. Tita, Dr. Armstrong, and Dr. Kaminsky, thank you for what you are doing on the front lines and in educating the community. And Mayor Wade, your support of the VProject is invaluable. To all of the teachers and staff in this town hall, thank you for what you do every day in educating our children, and a special thanks for what you have done through the pandemic. Your courage, creativity, dedication, and hard work will never be forgotten. And I have something else to thank you for. Thank you for your leadership in signing up to be vaccinated. You're an example to others to follow on taking the most important step anyone can take in getting a victory over COVID-19. Your educational community is about gaining knowledge by studying facts. I believe if someone gains knowledge about the safety and effectiveness of the vaccines, they will decide to seek vaccination. You are proof of that. The solution is right here for all of us. Governor DeWine has stated he's committed to getting all educators interested in a vaccine the first dose by March 1st. Locally, that commitment is being supported by the health department, even for educators whose interest develops only after learning more tonight and in the coming days. The Toledo-Lucas County Health Department will make every effort to get shots to educators who want them. At this time, if an educator did not commit with their institution, the health department recommends they notify their employer and then also go on and pre-register on the health department website. Schools are the fabric of our society and the anchors of our neighborhoods. What goes on in schools impacts the entire community, and that is so true right now. We need our educators like never before. In the next couple of weeks, our educators will show our community how you defeat COVID-19, victory over COVID-19 through vaccination. On behalf of the VProject, thank you to our educators for leading the way. And with that, I'm going to turn it back over.
Again, we just want to thank our mayor as well as our local health department, Eric Z, for their support of the schools. Again, thank our educators, in essence, our teachers, administrators, those at the building level who are in the trenches every day, putting themselves and sacrificing their own selves to be able to educate students, whether it's remote or within the buildings as well. Again, thank you to Mr. Savage and getting and rallying up the business community to get behind this initiative, to push this initiative as well as the education of it forward. And more importantly, thank to our governor and prioritizing education, just as we do, that allows educators to be along the line with our senior citizens to get the vaccination just as well. So with that said, we're going to move on the agenda, which is the introduction of our panelists. And I'm going to turn this over to our co-chair, Mr. Tom Hosler.
All right, thank you. One of the challenges we face in learning more about the vaccine is where you can go to get factual information. And if you're like me, I'm a little bit hesitant to count on my junior high lab partner, his Facebook post as a source of credible information to make this important decision. Sorry, Eddie, but that's not the place. So what makes this forum so important is that our panelists this evening are local experienced physicians. These medical professionals live here. They care for patients in our community, and they care deeply about our health. Our panelists are Dr. Anthony Armstrong, Dr. Brian Kaminsky, and Dr. James Tita. These medical professionals from our very own community have dedicated their lives to providing excellent medical care and leadership for Northwest Ohioans. We are so grateful for their time and willingness to help us this evening provide factual information to school personnel about available COVID-19 vaccines. We hope to provide our educators and support staff with the answers they're looking for so that they can make an informed decision when their turn comes to receive the vaccine. Dr. Armstrong is a board-certified OBGYN in a private practice group and holds a master's in public health degree from the University of Michigan and is currently serving as the president of the Ohio State Medical Association. He was past president of the Toledo and Lucas County Academy of Medicine. For Mercy St. Vincent Medical Center, Dr. Armstrong has served 10 years as Director of Medical Education and 3 years as Chief of Staff. Thank you, Dr. Armstrong. Dr. Kaminsky is the Vice President of Quality and Safety for the ProMedica Health System and Medical Director of the Emergency Department at ProMedica Flower Hospital. Dr. Kaminsky grew up in Sylvania, Ohio, and is a graduate of Northview High School. After graduating from BGSU, he attended medical school at Nova Southeastern College of Osteopathic Medicine. He joined the Toledo Hospital in 1999. Welcome, Dr. Kaminsky. Dr. Tita is the Chief Medical Officer for Mercy Health St. Vincent Medical Center, as well as the Medical Director of the Intensive Care Unit at St. Vincent. He has led numerous clinical research trials for the hospital. Dr. Tita is an experienced internal medicine physician with board certifications in pulmonary disease, sleep disorders, critical care medicine, and internal medicine. He received his medical degree from Midwestern University, Chicago College of Osteopathic Medicine, and completed his residency and fellowship at the Cleveland Clinic Foundation. Thank you so much, doctors, for being here and giving your time to help us become familiar with the information that we need. So we have some questions that we would like to pose to you, and we appreciate your response. So the first one is certainly an important one for many of our educators, and that is the vaccine safe for women who are pregnant? Does the vaccine affect fertility? Dr. Armstrong?
Well, first, thank you very much for having me be part of the town hall discussion tonight. And it's an honor to be part of the VProject. And so I'll just kind of jump right into it. And I think a little brief background I think might be helpful. ACIP or ACIP is a committee, and the acronym stands for the Advisory Committee on Immunization Practices. And what this group does is they make recommendations that go up to the CDC director. And after they're approved from there, then it goes up to the US Department of Health and Human Services. And then when they're finalized, then it goes into print form on the CDC's weekly report, and then it's updated as necessary. So in their latest recommendations, they actually do classify pregnancy, believe it or not, as a high-risk medical condition, independent of all the other comorbidities. And so their recommendations for pregnant versus non-pregnant is if they qualify to be able to receive the vaccine, it should not be withheld during pregnancy or during lactation. So how did we get there? And I'm simplifying this. What we do know about the vaccine is that these mRNA vaccines are relatively new, But the way they essentially work is they do not enter into the nucleus of the cell. So it does not interact with the DNA of the person who's receiving the vaccine. So in theory, it should not be able to cause genetic mutations. There's also a feeling that very little, if any, could cross the placenta and reach the fetal circulation. Very little, if any, would show up in breast milk. So there'd be no reason to delay breastfeeding or interrupt breastfeeding. Again, based on that science, we also don't think it has any effect on fertility, but we do have a little more data in numbers of people who have received the vaccine and have not, as far as we know, but this is short term, have had fertility issues as a result of it. So the original study group did not have pregnant women or breastfeeding women as part of it, but just several women did get pregnant. And as of last week, they haven't delivered, but the pregnancies are going well. So we don't have that data. So what do we know? We do know there's something unique to pregnancy, that even if you take an African American woman who is symptomatic positive with COVID, compare her to another African American woman who is symptomatic and positive with COVID, not pregnant, the risk for being admitted, being transferred to ICU, put on a ventilator, and mortality is higher during pregnancy. All the other comorbidities, hypertension, diabetes, et cetera, are just additive. So why would you want to give a pregnant woman the vaccine? Well, first you want to know, we know about the safety and the efficacy. We think we know that it's low risk, but again, we don't have the data yet, but just based on the mechanism of action. The other thing is, what is the prevalence of COVID in our community? What is the likelihood that a pregnant woman is going to contract it, either at work, or at home, in transit to work, wherever it might be? And you weigh those risks and benefits all together, and then have that conversation with the patient, and then offer them the vaccine, and hopefully they will be one of the ones as a recipient.
Well, thank you, doctor. And just taking that line of thought in terms of people that are concerned about whether or not to get the vaccine, that certainly is a population that is very nervous, and certainly in schools, the younger teachers are especially paying attention to that. So thank you. But kind of taking that further, today we're hearing about reasons why people aren't necessarily interested in getting the vaccine, and they range from the microchips that might be part of the vaccine, or some type of GPS tracking device that is in there. And as the mayor so eloquently talked about, that we do have an element of our community that is very suspicious and for good reason as to accepting a vaccine. So, how do you help talk us off the ledge and reach out to those that might be a little skeptical, sometimes for different reasons?
Well, there's no short answer to that, but I'll try to be brief. And this is just one of the many mountains that we're scaling right now. And whether you're in the medical profession or educators like you are, and I commend everybody who's K-12 and on the phone, because you are in people's houses. And so you are a trusted voice and faces. And that is part of what we must be able to do, that the message itself, and I know the VProject is trying to come up with specific, concise messaging that people can understand. So medical literacy is important too, because we know that sometimes people are afraid of what they don't know, what they don't understand. So making certain that we can educate people as much as possible is extremely important. And anybody can learn the answers to the FAQs. You don't have to be a medical expert. So whether you're doing a one-on-one like I might have in my office, or you're talking to a group of friends or family, whatever it might be, it's important to be able to offer up some reasonable opinion for someone. Hopefully they have that respect for you. So a lot of this, of course, is rooted in racism in the African-American population. So about 50% overall are vaccine hesitant, and the other half is probably willing to be able to get it. So yes, Tuskegee is something that we're sort of anchored in, but I don't think we are actually mired in just the Tuskegee and the failure of public health in an experiment that was just wrongful and downright evil. But still, through centuries of oppression, lack of access, and the digital divide that is still in between our populations. Everything that we've known has just bubbled back up to the surface with COVID. So all these social determinants of health have come to light. And now we are in a position where we need to have actionable items. And so I think when you approach the African American population or the Latinx, Native Americans, or anybody who's hesitant, just three things that I have found in my practice. And the first thing is sometimes you just got to get a really quick pulse on the patient or person you're talking to and try to mitigate their fears. So you can outright ask them, are you thinking about getting the vaccine? If they're hesitant, maybe I might not, or no, I'm not. Why aren't you? Do you know anything about it? Talk them through it. I have found that there's three really common reoccurring things that they're afraid of. Number one, can I get the virus from the vaccine? Answer simply no, because there's no live virus in it. Another reason why it's safe in pregnancy. Number two is the side effects, and I'm sure that Dr. Kaminsky or Tita are going to talk about that, so I won't go through it. But it's self-limited, extremely rare for anaphylaxis. The third thing is it was politicized, and it seems that it was rushed through, and African Americans and other repressed populations of people feel like they're being experimented on historically. And so it's like, I don't know what you're putting in my body. Like you said, the microchips, a LoJack, whatever it might be, an alien invasion. And so you have to be able to just talk to them about the history of it. The lead investigator was actually an African American woman from the CDC. They had a representative population of ethnicity, male, female, etc., in the population, and just try to mitigate those fears, and that the science is solid, the safety and the known or potential risk is solid. You can't cut corners with the FDA approval on that, but the bureaucracy and the paperwork that comes with that is what just gets postponed until this public health emergency is over, and then it goes back through the same process of final approval. So I think when you go through those things in your own little way, your own little canned speech, that you can get a lot of people who are especially hesitant, might get it, maybe will get it, but the ones who are anti-vaxxers, I don't know. Maybe somebody else has a real good answer to that. The last thing I want to say is sending them to media sites, social media sites. That's a plus minus thing. It's a double-edged sword because they may have a real distrust in even sending them to government websites, health department websites. But I think that human interaction is really how we're going to scale this mountain. Thank you.
Thank you, Dr. Armstrong. And I know you have another engagement that you have to flip out to, and we're looking forward to you joining back. So we really appreciate you making your evening work for us. So thank you very much. And we look forward to having you rejoin our conversation. Thank you.
I'll be back.
Dr. Kaminsky, welcome. And this is actually the second time that I've been part of a call geared towards educators. Dr. Kaminsky was part of I think we had about 40 to 45 superintendents a few months ago talking about the vaccine. So welcome, and I know you're very gracious with your time, so thank you very much. One of the things we just heard from Dr. Armstrong is, why should somebody get it? So I think a good question to jump in is why get the vaccine? How do the benefits outweigh the risks?
Well, again, thanks for having me, Tom. I appreciate being back here and being able to talk to this group. And thank you for even just taking the time to listen tonight. The fact that you're here listening and showing interest means that you're committed. And if you're considering at all personally whether or not you want to get the vaccine, hopefully we'll say something tonight that provides you with the facts and the information that's necessary. And thanks to the mayor and Romulus and to Sean Savage and everybody else here contributing tonight. It's going to be hard to be additive to what's already said. I thought that Dr. Armstrong really hit on a few really good points on why to get the vaccine. But truly, you know, the part that was resonating with me was when the mayor got on and he started to talk about the things that he wants to do this summer. And I'm absolutely sure that he's expressing a lot of things that many of us and many people who we work with or who we live with or who we're just around in our daily lives want to get back to. We want to get through the pandemic, and getting the vaccine is, if not the most important, one of the most important steps that we can all take as a community to get past the pandemic and get to those things that we want to get to: the walleye games, the mud hens, the outdoor events, and all those things that that we want to get back to doing. So that's probably the foremost reason that this is important. But if you can get just a little bit introspective with it, we understand that people are going to have questions. We understand that people are going to wonder truly if the information they're hearing is accurate, because when you start to search for information, and you know, the internet is our platform now, that's what we use. There's plenty of really good information, but there's also plenty of misinformation out there, and there's counter information. There's people out there that are deliberately spreading information that is incorrect. So what we would encourage people to do, if they feel any sense of hesitancy or any doubt whatsoever, is to look for trusted sources. And that might be different for different people. The first place I would ask people to stop would be their own doctor. Many people have good relationships with their doctors, and they've had entrusted relationships for years with medical conditions and families' medical conditions. So if that's somebody who you know and trust, go to your doctor and ask your doctor what he or she feels about receiving the vaccines and what he or she might feel the greatest risks and benefits are. The fact of the matter is that we've vaccinated in this country already, as of today, almost 30 million people. In the state of Ohio, we're close to 1 million. In the Northwest Ohio area, we're around 100,000. In ProMedica alone, we vaccinated about 20,000 people. And Mercy, I imagine, is just about the same there. So as far as safety and efficacy, if that is one of the concerns that people have, we've demonstrated pretty well right now that, you know, without observing significant side effects across the entire country, that this is a safe and effective vaccine. So it's for all those reasons that we think it's important. And in closing out that statement, I think it's important to also mention that, you know, many people, even if you don't live with somebody that's vulnerable or high risk, you're no more than 1 or 2 linkages away from a person like that. So whether it's a mother, father, brother, sister, friend, family member, grandmother, or somebody with a serious medical condition, if you're feeling a little bit of doubt at all, think about what we already know about COVID and what it can do to affect those populations of people, and really do it for them. I mean, that's the reason that we want to do this. We want to protect our most vulnerable so our community can get back to a state where we can put the pandemic behind us and just move forward.
No, thank you, doctor, and I want to pull in Dr. Tita for a moment, and you know, schools have been you know, back as Dr. Durant spoke of in different forms, and many of the audience here has contracted COVID and has dealt with that. So one of the questions that we're hearing is, for educators who've been on the front line and teaching, who've gotten COVID and have gotten over it, is it important for them to get the vaccine?
Well, I also want to offer my thanks as well, Tom, to being invited to this panel tonight. In terms of your question, the answer is yes. And the simple reason that we think people that have had COVID should also receive the vaccine is we think the immunity, which is stimulated by the vaccine, is actually stronger and more robust than that from natural infection. There have been some studies that have shown that the immune response from the vaccine may be 20 times greater than from natural immunity. The other thing that we don't know is how long natural immunity lasts. We feel pretty good that it lasts for about 90 days. It may last longer than that, but we don't know that for sure. Now, to be fair, we don't know how long the immunity lasts from the vaccine. Obviously, these studies will be ongoing, but with such a strong immune stimulus, it's recommended that everybody get the vaccine. And one other piece of evidence that I think is so telling here, and I read this in the New York Times yesterday, and there's been a lot of negativity about, what percentage. I know they're talking about some of the vaccines that will be applying for approval in the next few weeks. And if you combine all 5 vaccines, and they've been tested on 75,000 people across the world. Out of those 75,000 people that got one of the 5 vaccines, and remember that 2 of the vaccines are approved for us here in the United States, the Pfizer vaccine and the Moderna, there hasn't been one single death from COVID. And there have only been a few people that actually were hospitalized for COVID that received the vaccine. Compare this to a random sample of 75,000 Americans who have contracted COVID. Of that number, 150 have died and hundreds have been hospitalized. So you can really see how effective this vaccine is. And even if you focus on those percentages, and remember that has to do with whether people have the disease or not, if we can keep people from developing serious disease, and it looks like virtually every one of these vaccines can do that, that is a huge game changer.
No, thank you. That's great information for those that have had it and are wondering. Dr. Kaminsky, to come back to you, what would you say to one of your patients who's on the fence? And what advice would you give them? Well, certainly we heard a great endorsement, but what would you say to that person on the fence?
Yeah, at risk of repeating myself and repeating some of the things the others have said, the first thing I would say is, I understand, I get it. I understand why you might be hesitant. This came so fast, and there's still a lot that we have to learn from the vaccine as time goes by. And it's just natural and human nature with the rapid pace that this was developed to have some caution going into it. So I think I'd first try to, let that person know that I understand and it's totally rational and normal to be hesitant, and then try to understand what the true fears are. What is it that is making you reluctant about receiving the vaccine? And then start to talk about those things and then provide facts when the facts exist, which we have a number of different facts that have been rolled out here tonight. And then I would probably add it to it, since we have a group of educators, in the audience here today. If you're an educator, if you're a teacher in the community, if you're an administrator in the educational system, you're a leader in our community. And my God, we need you, and we need you to out there really embracing this. And people are going to look to you for advice. You have a circle of influence. And if you think there's any remote possibility that mindset will help change your mind and get it, I'd ask you to embrace that and receive the vaccine, because just the act of doing it will have a ripple effect out to your surrounding circle of influence and help others make up their own mind as they see you receive the vaccine and see that you're okay. So it's for all those reasons. And Dr. Tita made a great point that we know enough about this vaccine now that the people that we see getting it are not being hospitalized, they're not dying, and we know the risk of getting COVID. That's become perfectly clear over the last 12 months. There is a substantial risk over many other viruses that are out there, and that's why we're in a pandemic, taking all these precautionary measures. We'd like to unwind that at some point. We'd like everyone to participate in getting us there as soon as possible.
Thank you. Thank you. Dr. Tita, I'm going to be just very candid with you. I don't like needles. I'm kind of a wimp when it comes to getting shots. We have schools in Lucas County that are going to be heading down that path. Pretty soon, other counties like Wood County behind them. What can I expect? Wimpy me, what can I expect on vaccination day? And will it hurt? Very interested in that. And what can I expect afterwards?
Well, if you've ever gotten a flu shot, it was exactly the same. I mean, mine didn't hurt at all. It's a quick shot in a muscular part of your shoulder, and that was it. It was really a painless procedure, and I say that with all sincerity. In terms of afterwards, I had a sore arm that evening. By the middle of the next day, that was pretty much gone. And for the second shot, it was the same. I had no other side effects. You know, some of the common things that people who get side effects, and I want to stress that the majority of people who get the vaccination have either no side effects or a sore arm. Of those that do get some side effects, it might be headache, low-grade fever, chills, and fatigue. But again, it's self-limited. It may last hours, it may last a day. And that's really about it. In terms of serious reactions, as Dr. Kaminsky said, very, very rare. The CDC reported the third week of December, out of almost 2 million vaccinations which were administered, there have been reported 21 people who developed a severe allergic reaction. And that would be somebody who had swelling of their throat, hives, or wheezing. And so that's a very, very small number. And we are taking precautions. Patients who get the vaccine are generally observed for about 15 minutes afterwards. And all of our sites have equipment available to intervene should one of those very, very rare effects occur. So again, it's a very safe vaccine. I think the side effects, if they occur, are manageable, usually with Tylenol or ibuprofen. And again, it is not at all a bad experience.
Hey, Tom,
All
just
right,
take
so-
the Sean Savage unscientific approach and close your eyes and look the other way, man.
All right,
if I can-
I'm going to get through this.
If I can jump in with a quick rejoinder, since Sean did, I am hoping that significant weight loss is a side effect of this shot. Is that the case? I'm really, you know, please tell me that getting the shot is going to help me lose weight. No? Darn, you mean I actually have to eat healthy and exercise? All right.
The data's not in yet, Mayor.
As I get ready to hand off to Mrs. Casto with Maumee Valley, I just want to point out something here. I want to say thank you to Lynn and your team for putting this together and organizing it. Thank you very much. And I also wanted to mention Oregon schools and their help in feeding this out. And as I hand the baton off, we have educators from all across Northwest Ohio watching. And the three of us we're honored to be part of this, but working side by side with each of us are representatives from other urban schools in Northwest Ohio, suburban schools in Northwest Ohio, private schools, religious schools. We're all in this together and we're all working very hard. And we have one common theme and one common mission, and it is to put COVID down and put it down for good. And we know that we can accomplish this. There aren't many times where Dr. Durant and I agree on many things, and getting the Catholic schools and the public schools all together, you never know what's going to happen. But we've been working well together. We've been united, and we are here together to make sure to stress how important this is. So in that vein, I'm pleased to hand off to my colleague and friend at Maumee Valley, our partners. So thank you very much. Thank you, doctors.
Thank you
Thank
so
you.
much. And I want to thank the 350 to 360 people on Facebook who are watching this evening. We appreciate you tuning in. And as a reminder, as Dr. Durant shared in the beginning, if you want to put questions in the Facebook chat, we'll do our best to answer many of them. I'll start off with questions that we're seeing specific to particular conditions. And so maybe Dr. Kaminsky, I can toss this one to you. Folks are wondering if they are dependent on an EpiPen, is it safe to get the vaccine?
That's a really common question that we get, and a good one, so I'm happy to answer it. The only true contraindications to the vaccine as it relates to allergies is a previous allergic reaction to another vaccine. The other way to look at this is to look at the components of the vaccine. So the vaccine has the mRNA vaccine in it, which is new, so it's very unlikely that anybody would know that they're ever allergic to that, but there are other components in the vaccine. So there's a little bit of sugar, so glucose is in there. There's a little bit of saline, and then there's a substance called polyethylene glycol, which is a very inert substance that we use in many other medical therapies that's extremely unlikely to cause an allergic reaction. So just having allergies or an allergic reaction to something else in the past is not a contraindication to receiving the COVID vaccine. But if you know you've had an allergic reaction or anaphylaxis to another type of vaccine or to any components of the vaccine, you'll definitely want to consult with your doctor before you get the COVID vaccine.
Thank you, Dr. Kaminsky. Similarly, Dr. Tita, we have a question about folks that have diabetes. What are the concerns, if there are any, about receiving the vaccine if you're a diabetic?
There really aren't any specific concerns relative to diabetes. It should not be a contraindication. And as a matter of fact, we would recommend that as a pre-existing condition, making the person even more susceptible potentially to severe COVID disease.
Great, thank you. I'll let whoever would like to answer this one. For those that have tested positive with COVID-19, is there a waiting period after which you've received that positive test, perhaps you're in quarantine? How long do you have to wait between positive diagnosis and your ability to get the vaccine?
Well, Dr. Tita, I could take this one, and hopefully the next one will be a little bit more difficult, and we'll turf that one off to you if that sounds okay.
It's okay.
This is another good common question that we get, and we actually deal with fairly frequently, because it's not uncommon for people who are signed up for a vaccination to suddenly test positive just prior to receiving it. Or in some cases, we get people that test positive in between the two doses of the vaccination. And to put it really simply is that you can receive the vaccination and you can receive your second dose even if you test positive in between, so long as you're recovered from the illness. That's the simplest way to put it. And there are some definitions behind recovered. So the way that we define that is 10 days from the onset of your symptoms. But in addition to that 10 days, you have to be fever-free for that last 24-hour period, and you have to have improvement of your symptoms at the end of that 10 days. So as a general rule of thumb, if you're getting better or are better at the end of that 10 days, then you're ready to receive your vaccination. If any of that lingers or goes on longer, or if you're unfortunate enough to have been hospitalized and have more severe disease, you'll definitely want to wait for that period to end. And again, if there's any questions, consult with your family doctor if there's any doubt at all whether or not you should be receiving it.
Thank you, Dr. Kaminsky. Good to see that you have rejoined us, Dr. Armstrong. I'll pass this one to you. After the vaccine has been administered, and we have that, what I've heard is a 10-day waiting period after the second dose for efficacy, do we still need to wear masks and physically distance once we've received our vaccination?
Well, absolutely. Those CDC original guidelines that came out about hand washing, social distancing, and masking are still in place. Remember, the vaccines are still not 100% preventive. However, if you are one of those unlucky 5 or 6%, we're not sure that if you did get COVID after receiving the vaccine, that you aren't able to transmit it to other people. And so until we have that data, and especially until we reach that 70% mark where we can get to herd immunity, we absolutely positively need to keep doing those things.
Dr. Armstrong. John, I'm going to give our physicians a break and allow you the opportunity to answer a question. We have folks on Facebook who are curious about the VProject and want to become involved. For somebody that would like to join the VProject, what would be the best means to do so?
Great question. So I'll take this. If you go to vproject.org, there's an opportunity. In fact, I've already received some this evening of folks that are on this tonight that are volunteering. So you can send a message through the site, and then we are continuing. We try to have as big of a tent as possible for this. In other words, we want anybody that wants to be involved and help. There's going to be a place for you to help, regardless of your background, regardless of what you do for a career, whether you're working, retired. No matter what ethnicity you are, we are really emphasizing that this is a total community effort, and we need the entire community involved to get this done. And Romulus, I'm gonna bring you in just for 1 second, and just let us know what your kind of plan is as you roll into vaccination next week. I think it's pretty intriguing. If you can just give us a minute on that.
For myself, I'm going along the line of the skeptic, in regard to, growing up in my household and being skeptic of vaccinations and other things such as that, as well as even the flu shot within itself. And so, I think one of the things is I always watch when you talk about when there's apprehension within the group, it's always upon the leader to step up to take the first drink in order to set the path for others. And so my whole thing going into it is from a skeptic perspective. I'm going in to say, hey, I don't know. I don't know, but I'm gonna try. And at the end of the day, if I'm safe, the rest of you will be safe. And so my whole thing is giving somewhat of a testimonial of 1, going in there with the shot, 2, in regards to the whole shot process, 3, letting you know how it feels immediately after the shot, within hours after the shot, at the end of the day, the next few days, 48 hours, in regard to how I feel, in essence, whether it's my arm, how I feel, consciously, as well as my body. And at the same time, when I get to the second shot, which sometimes I hear there's a little bit more possible side effects, how I feel after that. And so, it's just giving my testimony, but at the end of the day, each one of us is going to respond a little differently. But I think it's important for a leadership perspective that at the end of the day, despite your apprehensions, how you grew up, in essence of you consider this the vaccination, other ideologies, is that when it comes down time for leadership, is that when it comes down who's going to take the first drink when others are scared and have fear, I said I'm going to do that and take the drink. And like I told them, now if I have some issues, I'm going to let the community know, hey, this is what's going on. But at the same time, I feel confident in essence of the vaccination within itself. We'll see how that goes, but look forward to see it. You'll see it on our social media page as well as with the media in regards to the trial and testimonials of getting the vaccination.
If I could just make a real quick comment to segue on what Dr. Durant said. We have been vaccinating our elderly population, and they would be excellent testimonials. I mean, you're young and robust, Dr. Durant, but if you put somebody up there who's 85 or 86, like my mother who got the vaccine and she didn't feel a thing and she was still breathing. Yeah, I think that goes a very long way.
Yep. My mom, Mrs. Savage, zero side effects, not even a sore arm. So, and she's feeling much better about being able to go out and about, once she gets her second one here in a couple of weeks. So just that freedom of returning to life. It's amazing to see our elderly population really, get what they deserve. And that's the ability to live life again.
Yep. I just want to share one quick story with you. We had elderly people who were scheduled to receive their vaccine at our site at St. Vincent's, who were scoping the place out a day or two before, just to make sure that they could get there and navigate, because they wanted to do everything they possibly could to make sure they would get that vaccine.
Thank you all for those testimonials.
I think that if I could just jump in with a perspective also, I think we should feel fortunate in this community that the process of getting our vaccination shot is so quick and easy. You look at the nightly news or however you get your news, you see places and California and Florida, where they're, these poor folks are waiting in line for 6 hours, and they're getting in line at 5 a.m. To get their shot. Every experience that I have heard of and been told, and if anyone on here disagrees, certainly speak up, but it is easy appointment, in, out, 20 minutes, maybe half hour tops. I mean, the system we have put in place, thanks to a number of partners, is a pretty dynamic system that if you want a shot, you'll get one, and you're not going to eat up your whole day doing it. It's in, out, fast, done, back to the rest of your day. And I think that's a real plus that we have, especially when you see some of these other cities and states having a harder time.
Thank you, Mayor.
And Mr. Mayor, we're also trying to think outside the box because when you mentioned, people are lined up, they're in their cars, but what about some of those most vulnerable neighborhoods, and they don't have the transportation? And so how can we bring it to them? And so that's part of the process that we're doing within the VProject itself.
That's fantastic. Dr. Tita, there's a question about folks that already have autoimmune diseases. If an individual has an autoimmune disease, could the vaccine make them more susceptible to other autoimmune diseases such as RA or MS?
The answer is we don't have specific data on that. On the other hand, knowing the way the vaccine works, it's unlikely. And again, I mean, that would be a vulnerable population in terms of developing severe COVID. So the recommendation is that all people, even with pre-existing autoimmune disease, get vaccinated for COVID.
Thank you. And before I give each of our doctors on the call just an opportunity to share any final words of wisdom, we are getting a few questions about side effects, long-term side effects of vaccination. And I know that we have not had an opportunity to do much research on the long-term effects, but as you think through how this vaccine works, is there anything that gives you pause that might indicate that it could create long-term side effects or complications for individuals who are vaccinated?
I'll take that one. I do not. We tend to think of this as a new vaccine because it's only been sort of on our radar for the last year, but actually this process was developed 10 years ago. And in essence, we were sort of waiting for this moment to be able to deploy this technology. Once we knew what the genetic code of the virus was, we were able to isolate that particular part of the genetic code that coded for the spike protein. And by using this remarkable technology, have a vaccine that was highly effective, ready to go and inject in people and be well tested in under a year. And that is truly, truly remarkable. It's a very clean vaccine in terms of the way it works. And I have no reservations about it. As a matter of fact, I mean, it is truly remarkable how we've been able to do this, and the hope that this gives us in terms of eliminating this disease.
Thank you, Dr. Tita. I'll give our final question to Dr. Kaminsky. All the educators on this call and those that work in schools care first and foremost, not only about themselves, but most importantly, the kids we serve. Is there any indication of when there might be a vaccination available for children, and any chance it's coming by the fall?
Yeah, so from what I read, it is coming. I can't say where a definitive timeline is, but there are studies ongoing. In particular, Moderna is studying down to age group 5. So there are clinical trials underway. As you can imagine, at the start of the clinical trials, we needed to move with speed. So the companies that were conducting the trials purposefully went into it to test against adults, because it's much harder to consent and to enroll children in clinical trials. It's definitely important, and it's something that needs to be done. We also know that children tend to express less severe disease. And although children can contract the COVID virus and can sometimes get very sick, the likelihood of that is much lower than in the adult population, and especially the elderly population and those with comorbidities. So just in a priority sense, it made a lot more sense to develop a vaccine and do those studies in the higher risk groups, and then take the time that's necessary to get the younger population up to speed. So my belief is that it's definitely coming. We're going to hear more, and there's so many other companies that are working on vaccines, including Johnson & Johnson, which we're hopefully going to have approval of in the next few weeks here. So the fall, not quite sure if that's the right time frame, but definitely we're going to hear more, and there will be more coming. And as we know, vaccinations are a huge part of our protective measures that we use for children. So more to come.
Thank you, Dr. Kaminsky. I'm going to give each of our physicians just a moment. If there are any final words that you would like to say to our teachers and to our school staff members that are on the call tonight, we'll start with you, Dr. Armstrong.
Thank you. Well, we know that the COVID has disproportionately affected people of color in the state of Ohio. And I think that what we're doing here is very novel, something special. I think it's best practice for the state of Ohio and maybe for the country. And, I commend, Mr. Savage for commissioning this. Having said that, once we have achieved our level of success, which I'm certain we can do, those social determinants that I briefly alluded to earlier are still going to be present. And I think this type of a coalition can be an excellent springboard to be able to address other issues and some actionable items to make things better for all Ohioans.
Great suggestion. Thank you, Dr. Armstrong. Dr. Tita, any final words?
Yep. Pandemics are historic events, and as we've been living through, we can see why. No doubt this will change history in ways that we don't even understand right now. But from those dark days last spring and even earlier this winter, we really have some hope now. And our challenge is to get as many people vaccinated as we possibly can. And we will begin to see those numbers fall and be able to get back to living normal lives. And I think there's a lot of hope. We just have to stay focused, continue to do those things that we have been doing all along: wearing a mask, washing your hands, social distancing, and of course, promoting the vaccine, because that's our way back to a normal life.
And I think we're all anxious for that. Thank you, Dr. Tita. Dr. Kaminsky, any final words?
Yeah, to all the educators that have taken the time to tune in here, I really thank you for taking the time, because that says that you have an interest, and you play a vital role in the community. And as I said before, you're all leaders in this community. People look up to you: parents, children, coworkers, friends, family members. And so they're carefully watching your actions. We need your leadership. We need your commitment. We want you to not even show an inch of hesitancy, because people are smart, and people who know you will pick up on that. So we want you to run the message up the flagpole. Dr. Durant, it's amazing what you're doing, but you're giving a play-by-play of every minute that goes by after you receive the vaccine. So I think that's the ultimate expression of commitment. Not only am I going to do it, I'm going to show you all what happens to me after I get it, and I'm going to put it out there. So thank you for doing that. And although not everyone would possibly, be able to do that, what we want is your commitment. We want you to spread your influence in your circle of friends and professionals professionals that you work with by showing that you embrace the vaccine and that you're willing to do it, not only for yourself, but for the people around you who are vulnerable.
Thank you, Dr. Kaminsky. I hope those of you that are listening, what you have heard tonight is that we are all in this together. On behalf of the VProject K-12 Education Committee and my co-chairs, Tom Hosler and Romulus Durant, I want to thank Dr. Armstrong, Dr. Kaminsky, Dr. Tita for giving us your time this evening and continuing to help educate our educators in order to make informed decisions. This event also was not possible without a lot of behind the scenes help. And so I am grateful for those who partnered together to make this work. Don Schiavone of Oregon City Schools for running the call and live streaming to Facebook this evening. Matt Giha and Christina Wolf of Springfield Schools who have been feeding me questions behind the scenes from Facebook. Katie Junga of SSOE and Rachel Ryan of the City of Toledo who helped us develop promotional materials and get them out to all of our educators. And then all of the school leaders who have helped push this out and promote it this evening. This event truly has been a collaborative effort between public, private, and parochial schools, just as Mr. Hosler said. And our one true goal is to vaccinate as many individuals as possible, to protect our beloved teachers, and to help all of Northwest Ohio in the process. Thank you for joining us this evening. Thank you, Mayor, for being with us. And thank you, Mr. Savage, for forming this VProject in order to help us get the information out. We appreciate you being here. Have a great evening.
Thank you.
Thank you.